I had a spinal cord injury 5 years ago on October 5th, 2014, when I was mountain biking in Snowmass Village in Colorado. And from there, I had 3 weeks of ICU care. And I had 3 months of intense spinal rehab, and then about 8 months of outpatient rehab, which is about like two to 3 days a week for about 8 months. And I just always enjoy working with staff who are very personable, who don't take, like, because I mean, I am like a more complex patient given my disability, but I really enjoy people who just, like are relaxed and, treat me like any other person, and just, ask me how my day is going and maybe tell a joke or two just to, I don't know, just to lighten up the interaction. Like that always makes it so much better, because I used to get really tense about going to the doctor, but I really don't anymore. But I know a lot of people do. And so I think for the people who do have that tension going in to see the doctor, I think having a really personable, friendly staff member really loosens somebody up, and it makes a huge difference, even though you think it's just a minor thing. Like to some people it's everything. Doctors who aren't willing to listen to patients as far as why they're doing what they're doing, like if they're not accepting a certain treatment, or if they're choosing a treatment that the doctor doesn't agree with. um, I respect a doctor who gives their opinion about like what they believe is the best course of action, but I don't appreciate I don't appreciate it when a medical provider um, shows like an outward frustration. It's just like, I get it that, like, people get tired and stressed out and they have moments of weakness, but it's really unproductive to let that out. Like, I mean, like you gotta hold that in, like, and don't beat yourself up when you can, because like I said, everybody has their moments, but just do your best to reduce those and keep them as minimal as possible, I would say. What matters most to me when it comes to healthcare is just having medical providers who are willing to listen and not make assumptions about their patients, because a lot of times, I know myself from being in the social work field, like it's easy to, in the field of mental health, it's easy to get caught up when you look at somebody's charts and you see a diagnosis and you're like, okay, like I've seen this before, I know what to do, bam, go. But like a lot of times, like there's more things going on than just what the papers say. Sometimes patients aren't including the whole story. Sometimes they're either they're not having a good interaction with their provider who's charting, and they don't tell them everything because they don't feel comfortable with them. Um, and another thing too is, uh, sometimes people don't sometimes people don't open up. So asking them questions and getting that whole story um, is important, and asking them questions, trying to get them to talk, and trying to get them to open up and feel welcome to do so. And I think those are two of the biggest things, other than just being friendly. If I was to say something to the like patients, I'd say like sort of similar, and on the other side, like be your own advocate, and like write down what you want to say before the appointment, and just stand up for yourself. And if you don't like the provider who you're talking to, or you don't feel comfortable talking to your provider, ask for a different one. And you have that right. I mean, it's your health, it's your life. So um, don't back down.